I mean, ultimately, we all want the same thing, don't we? So we all want to improve care and do that in a sustainable way. And you need multiple perspectives to do that. So you need to understand the clinical processes and the clinical care pathway, but you also need to understand the costs of each of those steps in order to make the best possible decisions. And the third element is you also need to understand the patient perspective. So I think if you manage to bring those three things together, you have a much better understanding of how you can improve the system to deliver what the patient needs in the most clinically effective and cost-effective way.
Before we even thought about embarking on a quality improvement journey, we measured lots of things. We looked at lots of things from a financial perspective and a clinical perspective. What we never did was bring those two things together. So I think the advantage of using a quality program has been just that. We've got finance staff talking to frontline staff. So when we run projects, we have finance staff in the room, and that's given them a deeper understanding of the services that they're financially managing. And it also gives clinicians the chance to query and ask questions about the finances and, well, why do we do it that way? Why does it cost this? Why don't we see that? Why don't we see more of this? And that's really given us a much broader knowledge base between clinicians and finance professionals.
Clinicians come in to work to try and do the very best they possibly can for their service users. And if you don't work collaboratively, the risk is that you can feel like finance is constraining you from doing what you possibly want to do, and then you can start to feel powerless in the system. So I think one of the real potential benefits of working together is that everybody starts to understand all of the elements of what it takes to provide care. And then you have more control. You feel like you understand how the system operates, and you have more control over what happens and what decisions you make in your clinical workspace to do the best you can with what you have. And I think taking that final part of that statement, doing the best with what you have, is a really important extension. And the more people we can get to own that, the more likely we are to meet the challenges of the healthcare system today.